Hello, I am Divyansh Ramteke, second year MBBS student at DPMC Jalgaon. I am going to present a case study on organophosphate poisoning. Definition: organophosphate poisoning is a toxic condition that occurs when an individual is exposed to organophosphate compounds, which are a class of chemicals commonly used as an insecticide, pesticide, and nerve agents. Organophosphate poisoning can occur through various routes of exposure, including ingestion, inhalation, or skin contact. This chemical targets the nervous system, inhibiting the activity of the enzyme acetylcholinesterase, leading to the accumulation of acetylcholine and subsequent poisoning. Symptoms of organophosphate poisoning: neurological manifestations. Organophosphate poisoning commonly presents with symptoms such as excessive salivation, sweating, blurred vision, muscle twitching, and convulsions. Respiratory distress: patient may experience breathing difficulties, chest tightness, and respiratory arrest due to the effect of organophosphates on the respiratory muscle and diaphragm. Cardiovascular effects: organophosphate poisoning can lead to increased heart rate, irregular heart rhythms, low blood pressure, and even cardiac arrest. Common sources of organophosphate poisoning: in agriculture, farmers and agriculture workers exposed to pesticide; in home use, misuse of insecticides or exposure to contaminated surfaces; in industrial setting, worker handling pesticide in manufacturing or storage facilities; and accidental ingestion, mistakenly consuming household products containing organophosphate compounds. Medical interventions: activated charcoal to absorb remaining toxins in the stomach; antidotes such as atropine or palidoxime to counteract the effect of organophosphate; suppurative therapies to manage symptoms and stabilize vital signs. This is the mechanism for organophosphate compounds. Case study analysis. Patient's profile: a 32-year-old farmer with no prior history of poisoning incidents. Symptoms and timeline: experiences respiratory distress, confusion, dizziness, vomiting, excessive sweating, excessive salivation, blurred vision, muscle weakness, and abdominal cramps within the 2 hours of pesticide exposure. Exposure source: the patient reported exposure to an organophosphate pesticide while spraying crops without adequate personal protective equipment. Clinical presentation: upon admission to hospital, he exhibited the following clinical signs and symptoms. First, excessive salivation. He complained of excessive drooling and had a notable amount of saliva on his clothing. Blurred vision. He had difficulty focusing on object and reported seeing double. Third, muscle weakness. He experiences muscle weakness particularly in his arm and legs, making it difficult for him to stand or walk. Fourth, respiratory distress. He had a labored breathing with a decreased rate and depth of respiration. Fifth, bradycardia. His heart rate was significantly lower than normal. Sixth, diarrhea. He had multiple episodes of watery diarrhea. Confusion. He appeared disoriented and confused, unable to provide coherent response to questions. Initial assessment and diagnosis. Based on his presentation and information provided, the medical team suspect organophosphate poisoning. The diagnosis was confirmed with blood tests that showed elevated cholinesterase levels and presence of organophosphate metabolites. Treatment: he was immediately started on treatment for organophosphate poisoning, which include first, atropine. Intravenous atropine was administered to counteract the overstimulation of parasympathetic nervous system caused by organophosphate. Second, palidoxime. Palidoxime was given to reactivate inhibited acetylcholinesterase enzyme, which helped break down excessive acetylcholine. Third, diazepam. Intravenous diazepam was administered to control seizures and manage muscle spasm. Fourth, gastric lavage. Activated charcoal was administered through gastric lavage to remove any remaining organophosphate pesticide from his stomach. Fifth, mechanical ventilation. He was put on mechanical ventilation to support his breathing, as he had severe respiratory distress. Response to the treatment: over the course of several days, his condition improved significantly. His cholinesterase levels returned to the normal, and his symptoms gradually resolved. He regained muscle strength, his vision cleared, and his confusion abated. He was weaned of mechanical ventilation, and his heart rate returned to the stable rhythm. Some questions on the topic. First, what is the primary mode of action organophosphate in organophosphate poisoning? A. Inhibition of acetylcholinesterase. B. Stimulation of acetylcholinesterase. C. Inhibition of adrenaline production. D. Stimulation of serotonin receptor. The correct answer is A. Inhibition of acetylcholinesterase. Second question, which of the following is a common source of organophosphate exposure in agriculture workers? A. Antibiotics. B. Insect repellents. C. Pesticide, and D. Household cleaners. The correct answer is C. Pesticide. Third, which organ is particularly affected by acute organophosphate poisoning? A. Heart, B. Lungs, C. Liver, and D. Kidney. The correct answer is A. Heart. Fourth, which of the following symptoms is not typically associated with organophosphate poisoning? A. Excessive salivation, B. Muscle weakness, C. Increased heart rate, and D. Dry mouth. The correct answer is D. Dry mouth. And the last question, what is the initial treatment of choice for organophosphate poisoning? A. Antibiotics, B. Atropine, C. Steroid, and D. Antifungal. The correct answer is B. Atropine. Thank you.